Hello, my name is Julian Troller, Chair of Intellectual Disability Mental Health at UNSW Sydney and Clinical Academic at South East Sydney Local Health District's Mental Health Program. I'm delighted to be able to share today with you a new resource that researchers at UNSW Sydney have developed. It's a series of easy read resources providing information about public mental health services in New South Wales. This video introduces the resources. To understand how to use the resources, please see our second video. People with intellectual and developmental disability and other cognitive disorders experience higher rates of mental health problems than the general population and are more frequent users of our mental health services. However, information about services is often complex and not accessible to these individuals. Accessible information helps people navigate mental health services and understand what is happening to them during their mental health journey. Using accessible information addresses our research findings of gaps in the availability of easy read versions of key documents within the New South Wales Mental Health Service. Easy read materials adapt standard information into a briefer copy using simple language and pictures. Easy Read helps people who may have difficulty reading standard documents and can be provided to anyone who might require simple information at the time due to health crises. It also assists mental health professionals to explain complex healthcare concepts to clients. Through consultation with people with intellectual disability and other stakeholders, and using a co-design approach, we developed a series of easy read information sheets on mental health supports and services, depending on level of need, and questions to ask community and hospital service providers, and on information on key sections of the Mental Health Act, including types of admission, community treatment orders, and the Mental Health Review Tribunal. Easy read summaries of statements of right documents for voluntary and involuntary patients, and the rules around community treatment orders. These summaries are designed to support the understanding of the standard versions of these documents, but not to replace them. And a series of information sheets for people receiving care from inpatient mental health services. These are provided as modifiable templates that services can adapt to meet their needs. There's also a toolkit available with information on how to support individuals to use Easy Read resources and how to make information accessible. The resources are available from 3DN's website. There's a section for health professionals and for people with intellectual disability and their support networks in an easy read format. The resources were developed by researchers here at 3DN and at the Social Policy Research Centre at UNSW Sydney. We'd like to thank the Mental Health Branch, New South Wales Ministry of Health, for funding this project. And we'd invite you to see our second explainer video with more information on how to use the resources. Thanks for listening, and I hope you find these resources very helpful in your everyday clinical practice.